Many of you know her. I'm probably like the only one who doesn't. Kelly Allen is the Executive Director at the West Virginia Center on Budget and Policy. She joined the center in 2018. She holds a Bachelor of Arts in Political Science and Communications from West Virginia University and a Master's of Public Administration from Penn State University. Prior to joining the West Virginia Center for Budget and Policy, Kelly advocated for health policy and saw the importance of the Medicaid expansion and access to health coverage for the people of West Virginia. As director of the center, she engages with residents, stakeholders, and lawmakers on tax and budget issues, health policy, and issues that impact women and families. Kelly's talk is titled Federal Cuts, Local Impacts, and will address the recently enacted, I call it the Budget Act, and how this act will disproportionately impact West Virginia. So with that, Kelly, be careful about the wires.
Thank you. All right. Thank you all so much for inviting me to be here tonight. I know when we set this up, we weren't sure if this would be done yet, and it is, but it's still very worthwhile talking about what the impacts are going to be for West Virginians. And thank you so much for sharing that bio. I just wanted to say a little bit about how I got into this policy space, because I came into this work through health policy, and I think a lot of you all are here because you really care about health policy. So whenever I finished my undergrad degree, and I was a wandering person that wasn't sure what I was going to do next, for a short period I worked at WVU hospitals, and it was after the ACA had passed, but before it was implemented. And for a time there, I was a financial counselor, so my job was to go into a hospital room when people were having a pretty terrible day, probably. They were either really sick or had an accident or something like that. And if they were uninsured, basically, they had to, make a list of their assets on a sheet of paper. And if essentially the implication was if the value of the things that they owned was less than their hospital bill, they could get charity care. But that's a pretty crazy implication. People were, there wasn't an option at that point for people who were uninsured, other than losing everything or relying on the charity care of local hospitals. And it was a little bit of a radicalizing experience. But fortunately, soon after that, the ACA rolled out. West Virginia was a state to adopt the Medicaid expansion right away. That wasn't a given. That was really important. And right away, 165,000 West Virginians gained access to health coverage that hadn't had it before. My next job after that was being a navigator, which was helping people sign up for health coverage, either through the Medicaid expansion or through the Affordable Care Act. And through that process, I met hundreds of West Virginians for whom the emergency room was their only access to health care prior to that. It was only 11 years ago at this point, but it feels so long ago. Mental health care did not have to be part of health insurance. Pregnancy coverage, maternity coverage didn't have to be part of health coverage. Substance use treatment didn't have to be part of health coverage. And if you only had access to health care through the emergency room, you couldn't get maintenance medications or preventive care. For many people, something had to get really expensive and really serious and become a crisis before they were able to get care. So the Medicaid expansion was deeply important for West Virginia. The ACA marketplaces for the same reason. I met probably dozens of people who are small business owners who couldn't get health insurance prior to the ACA marketplaces. There wasn't an option, particularly for people that had pre-existing or serious conditions. So the work that folks in this room have done to protect against some of the worst things that happened in this bill, and there were worse ideas that weren't ultimately included in it, have truly saved coverage for a lot of people, saved lives of a lot of people. And then the other memory I had is the last time I was in this room was, I think, in 2017 when we were fighting against the ACA repeal and losing the Medicaid expansion altogether. And so much of that work back then helped make Medicaid, I think, the powerhouse that it is now. I remember in 2017, well, when I was a navigator, when people would ask when they were signing up for Medicaid, 1 in 3 people would say, "Is this Obamacare?" And we would kind of be like, Because we wanted people to get health coverage, but it had that stigma associated with it. And I think you would never have that now, because Medicaid it's on par with Medicare in terms of popularity. It's more popular than the president. It's more popular than any of our congressional representation.
That's not a high bar.
In West Virginia, even. Yeah. So I say all that to say that the public narrative, I think, is on our side in a way that it wasn't in 2014, 15, 16, 17. We don't have to be wishy-washy about whether we're talking about Medicaid or Medicare. And so much so that there was no hope ever of passing this if they called it ACA repeal this time around, right? There was no hope of fully repealing the Medicaid expansion. So we've made a lot of gains in terms of protecting these programs. So I guess I want people to hold two things at once, that the advocacy that folks have done over the last 8-9 months has mattered. And I think there are clear wins in things that didn't get included in this package. And people like Senator Jim Justice were critical in the worst things not being included. There were provisions that would have taken down the federal match for the Medicaid expansion that he stood up and said, I cannot support, and then it was not part of the package. So as I'm going to be talking about this package and calling it the worst cuts to Medicaid and SNAP in history, I just want people to hold alongside of it that there was a lot that was protected, and that the advocacy that folks have done matters. A, because things were protected as part of the package, but B, because this package is really toxic. If you hear our congressional representatives talking about it, it's interesting what they're highlighting that is in the package, and it's not the Medicaid cuts, and it's not the SNAP cuts. So let's try to hold those things at once, that it's a really bad loss, but also folks in this room and all over the state and all over the country made a really big difference. All right, so I'm going to talk about a few different things on the federal landscape. Oh, the first thing I wanted to say, too, was what do we want to call, how do you want me to refer to this law? OBBBA feels like a Star Wars term. Budget bill, is that what you said, Rich? Budget bill. Okay, shorthand, budget bill. Okay. Well, that's when I'm saying that, I'm referring to the federal reconciliation package that just passed. Okay, so just to ground this conversation a little bit, we've said a lot that West Virginia is disproportionately harmed by this package. We stand to benefit the least from a lot of the tax provisions because we don't have ultra wealthy people in West Virginia for the most part, and we do stand to lose the most because of the importance of federal programs in our state. Nearly half of our big state budget comes from federal dollars, 48% in this fiscal year, and the national average is 36%. So because we get a disproportionate share of our budget from federal funds, we stand to lose more. And folks know why. We have high rates of poverty for stubborn, decades-long reasons. Folks have health issues because of the industries that are prevalent in our state that made people outside of our state lots and lots of money, but in a lot of cases made our own people sicker. And stubborn poverty and chronic health issues in an aging population. We also are pretty reliant on federal jobs, which I think could be a little bit surprising to people. So after Virginia and Maryland and DC and a couple of other states, West Virginia has one of the highest share of its workforce that's employed in federal jobs. I think a lot of that is the legacy of Robert C. Byrd, the reason that we have NIOSH here in Morgantown, the FBI facility in Clarksburg, and different places throughout the state in Parkersburg and other. So in this congressional district that we're in, Riley-Moore's congressional district, 5.5% of the total workforce is federal workers. So when we talk about DOGE and different efforts, we also stand to lose disproportionately when we see the federal workforce cut. And then this is just a little overview of some other things. So when we talk about that half of the state budget comes from federal dollars, that's not counting SNAP dollars, because SNAP goes straight into people's pockets. We have a lot of people who rely on SNAP. 1 in 6 people in our population, including about 100,000 children, rely on SNAP, which also brings hundreds of millions of dollars, federal dollars, into our state each year. So that's really critical for retailers and grocers. And there's a lot of research on the economic impact of SNAP that says it has an economic multiplier effect. So $1 in SNAP really brings in $1.50 or more to an economy. We know about, 1 in 3 residents rely on Medicaid or CHIP for their health coverage. A lot of those are folks that are also on Medicare. I think maybe people know as a result of this process, but I've always find people are surprised to learn that Medicare doesn't pay for long-term care, nursing home care. That's often Medicaid. And then we know our school districts receive a lot of federal dollars, more than $350 million each year. And then Social Security also isn't counted in our state budget, but that goes directly to folks. So these are all important federal programs that lots and lots of households in West Virginia rely on. All right, so I'm going to center this in 3 different buckets. So federal cuts that we are going to talk about tonight have kind of centered in 3 different areas. We've got the DOGE cuts and freezes and layoffs, which I think folks are pretty familiar with. Congressional action, which will be the Star Wars bill, and then what's on the horizon as far as potential administrative changes and proposals. And I just wanted to flag for folks, you can use the QR code if you want. We are trying to track DOGE cuts in West Virginia and get a cumulative impact of how much the state has lost. And I actually updated our DOGE tracker today, but not this slide. So we know DOGE cuts have already cost West Virginia at least $250 million and 400 jobs when we look at the data. And we are crowdsourcing this information. Sarah just shared with me, I think, federal library funding that I don't have on this. We're taking a really wide definition of DOGE. So DOGE specifically froze a lot of grants and federal funding and different things. There are also federal layoffs as a result of that. We know AmeriCorps Vista jobs lost, over 200 across the state. And then what we added today was the $33 million in U.S. Department of Ed funding that the department announced that they have frozen or holding on to, even though they were congressionally required to distribute that to states on July 1st. So there's a lot of stuff going on, and we just want to make sure we are trying to gather it in one place so that we can really show a cumulative impact of what it's having on West Virginia. So if I missed something, if you take a look at this and you see something's missing, or you are somebody that's impacted and you want to share your story, please let us know. Please reach out. We want to keep updating this as often as we can. All right, so now we'll talk about the budget bill. It changed a lot between the last couple of days, so I wanted to go over what was actually included in the final budget package. And I reserve the right to be wrong about some of this because we're still analyzing what was in the final 900-page bill. But this is a pretty good overview. And here are kind of 4 or 5 main things that you should know about the budget bill. So one is that it takes away health insurance, increases costs, health costs for a lot of families. The big part of the Medicaid changes that were part of this package are implementing a lot of new bureaucratic red tape to qualify for Medicaid. We were just talking about DOGE. We've heard these same folks say that government is bad and bureaucracy is bad and red tape is bad. But to be clear, all of these policies rely and require a lot of new bureaucracy. So asking people to get their eligibility for Medicaid redetermined twice as often as they did before. Asking people to prove every week or every month that they worked at least 20 hours a week, or if they didn't work, that they were caring for somebody, or that they volunteered or something. Those require building new systems that do not currently exist. Kentucky was thinking about doing work reporting requirements a few years ago, and they estimated it would cost them $250 million to build a system that would actually be able to follow through on tracking people proving that they work 20 hours a week. This bill did not include any sort of funding to build that bureaucracy, right, to build that system that's going to be required. And in fact, several states that were considering doing these sort of work requirements, make people on Medicaid pay co-pays, those sorts of things, actually, red states included, went down the process and then decided not to do it because they realized that it's really hard to implement and that there's a lot of errors baked into it. New work requirements, new eligibility requirements, new co-pays that will result in coverage losses for an estimated 50 to 100,000 West Virginians by 2034. The Senate actually, this was a provision that the Senate made worse. I think our House members and other House members had hoped when they passed the version of the bill that it would get cleaned up a little bit or it would get better in the Senate. In fact, I think some people said that on the record. And in fact, the Medicaid cuts got a lot worse in the Senate. They went from $800 billion to $1 trillion. They actually added people who would be part of the work reporting requirements on Medicaid to the population. Now parents with children over the age of 13 are at risk of losing Medicaid if they aren't able to successfully report that work. So yeah, we know that that's going to result in a lot of coverage losses. And I think this is probably the least unpopular provision that's part of this package, because it's kind of, I think, when people hear like, yeah, you should have to work to get Medicaid, it feels like it makes sense to people. But I think what's really important to go back to is that this has never worked in the states that have tried it. It's just really hard to implement. Arkansas is a state that tried it under the first Trump administration. The program was in place for about 6 months. And 95% of the people who lost their coverage were working, or they should have been eligible for an exemption. They were ill, they were disabled, they were caring for a child, but they lost their coverage anyway because if you're self-employed, it's hard to have that documentation. If you're caring for a sick family member, just think about all of the challenges that people will encounter. If you have to upload these documents and you live in a place that doesn't have great broadband, there's just a lot of barriers that result in people who are eligible being the ones who get kicked off. So that's the big part of these coverage losses. That's how we think 50 to 110,000 West Virginians who should be eligible will lose their coverage. Another way this is not going to kick off people who are eligible, but kind of flies in the face of what makes sense to folks, is that you actually have to prove that you're working at the front end of Medicaid application when this is rolled out. So the example I keep using is 300 or more coal miners in the southern coal fields who've lost their jobs or will be losing their jobs this summer. If this policy were already in place, if any of those people applied for Medicaid, they would be ineligible because they aren't working anymore. But this is the actual moment that people need Medicaid, right? So we actually are implementing this policy that turns people away at the moment that they need it most. So we're going to see a lot of coverage losses on both ends. People who should be eligible, but also people who are like, yeah, that's who Medicaid is for. I think some of this points to like the hastiness of the process, like that there wasn't a lot of thinking through these kind of unintended consequences that could have been better if this wasn't rushed through the process. We'll go through the timeline a little bit later, but cynically, this provision for Medicaid work reporting requirements goes into effect no later than December 31st, 2026. So there's a long runway, maybe it's not that long, a little over a year, after a midterm election, whenever this is actually going to get implemented in West Virginia. So I think one thing we have to do is like keep talking about it, right? Because it's going to take a while before folks really start to feel the impacts of this. The other piece of this that is going to result in a lot of West Virginians losing coverage is that this package did not extend the premium tax credits that help folks who get their health coverage on the ACA marketplaces. That's going to result in health coverage going up by like 150% for a lot of folks who don't get coverage through their employer, so they buy their insurance on the ACA marketplaces. That's estimated to impact another 15,000 residents or so. And the people hardest hit by this are people who are between like 55 and 64, because health premiums are really high for people as they age. So those credits are really, really helping make health coverage more affordable. So we're going to see a lot of folks lose coverage there. That one actually starts on January 1st of next year. So that is something that we're going to start to see impacts right away. And those 15,000 people will lose coverage because it's not going to be affordable for them anymore. And when we put all those things together, that means that the state is expected to lose $6 billion in federal health care dollars between now and 2034. That's an estimate from the West Virginia Hospital Association. They're using that figure as well. So it's a combination of a few things: the coverage losses, some funding changes. But that's huge, $1 billion a year almost. is almost certainly going to have an impact on everybody, whether you're on Medicaid or not, because those are jobs, right? Those are potential healthcare layoffs. We've heard a lot about hospitals that are operating near the margins already in rural places that are at risk of closing. So I think for folks that think they won't be impacted because they're not on Medicaid, they could be if the local hospital has to close an OB ward, or the hospital has to close its doors altogether, or staff leaves. So there's going to be pretty sweeping impacts on everybody. The next bucket of things in this legislation were the cuts to SNAP. So we said the Medicaid cuts were the largest in history. The SNAP cuts are also the largest in history. So it's a lot of the same things. It's just kind of adding a lot more hoops to jump through for folks to be on food assistance. So SNAP already has work reporting requirements as part of it. So for people who are between 18 and 50, they already have to work 20 hours a week, or they're not eligible for SNAP. This extends that up to people who are 65, and it also extends it to children, people with children over, I want to say 14. And this is another bill that the Senate made worse. Initially in the House version, it exempted veterans, people experiencing homelessness, and former foster youth from these work reporting requirements, and the Senate took those protections out. So this means, children. SNAP goes onto one card for the whole family, right? So this will impact children, because if there's less money on that card for the family because the parent lost their SNAP, inevitably that's less food on the table for a kid. And it's also impacting folks who may be retired already, folks between 60 and 64 who are now going to be subject to these reporting requirements. We said at the beginning that SNAP brings hundreds of millions of federal dollars into our food economy each year. So with those being lost, we know that's going to have an impact too on jobs in the retail sector. And when we've seen SNAP cuts before, we have seen rural grocers close. The last grocery store in Clay County closed a couple of years ago when the pandemic SNAP boosts ended, and they blamed that. Basically, we have fewer sales because of a result of that. So we know that's going to have pretty broad impacts on our food economy throughout the state. And then the other thing this does is require states to pay for a portion of SNAP benefits. So right now and forever, food assistance has been 100% federally funded. And this will require states to onboard a part of SNAP benefits onto state budgets. It could be up to about $85 million annually for West Virginia, which there's not a lot of room in the state budget right now. We haven't funded health or child care for how many years now because there's no money. So it's going to be really hard, I think, for state lawmakers to find that space without cutting something else that is really important that the state budget pays for. But a big thing is that it breaks that long-term commitment of food assistance to be federally funded. The other thing I think I would say about that is that nothing about these changes is actually reducing the cost of healthcare or reducing the cost of food. It's simply shifting the cost of those things downward onto the next level of government down, right? So it's telling the state to figure it out. There are things that could have been done in Medicare and Medicaid that actually would go at waste. And I think there are people in this room that would probably have recommendations about that. There's things about Medicare Advantage and all these other things that could actually I think things about drug prices that could actually reduce the cost, like that the United States writ large pays for healthcare, pays for food assistance. This doesn't do any of those things. It saves money just by saying somebody else is going to have to bear those costs. So that's really just the next piece of this. It really passes the buck, pushes those costs down onto state lawmakers, and it increases the burden on our state's charitable network. So we mentioned it shifts a significant portion of SNAP costs annually onto the state budget. That amount could change based on some different factors, but it's going to be tens of millions of dollars basically for the state budget to absorb for SNAP. That $85 million, that's more than we spend on childcare, CPS workers, and the Promise Scholarship combined, just to put that in perspective. And those are things that we've all acknowledged we're not spending enough on right now, and we haven't been able to increase our spending on those things. It also restricts how the state can pay for its share of Medicaid. So Medicaid is already a federal and state shared program. The state puts in a little bit and the feds put in a lot more. It makes changes to a provision called the provider tax, which I will not explain. But basically, it's going to shift costs onto the state's budget because it kind of takes away other ways that the state can pay for its share of Medicaid. And that and the SNAP change are both going to put pressure, I think, on state lawmakers to make cuts. Every year, the Medicaid commissioner comes in front of the legislature and they say, what's going to happen if we don't give you all the money that you asked for? And every time she says, we will cut provider reimbursements or we will get rid of optional services. And I should have pulled up a list of optional services, but so the feds have requirements, things that Medicaid has to do: inpatient hospitalization, outpatient care. Things that are optional in Medicaid are prescription drugs, home and community-based services, substance use treatment, a lot of things that don't feel optional. So in the upcoming years, I think we're going to have to be really vigilant on the state if we aren't able to reverse some of these things at the federal level to not get rid of some of these services that are really important, that they're going to have to show up and put some money out, or we're going to have to make changes and put pressure on our federal representatives to roll back some of these things. And of course, if provider reimbursement rates go down, that impacts all of us too, right? Because that means commercial insurance prices go up and all of those sorts of things. So these are things that have a lot of rippling repercussions for the whole healthcare system. We talked a little bit about the new administrative capacity that's going to be required to administer these programs. So at the same time we're seeing state budget pressures too, the state is going to have to figure out how to create a system that allows these, allows us to implement these policies. Georgia is a state that recently implemented work reporting requirements voluntarily. They expected that, they didn't expand Medicaid at all until they were given permission to do these work reporting requirements. They expected about 300,000 people to sign up, and it's been more like 10,000, maybe even less than that. One, that shows how difficult it is to meet these hurdles to do the work reporting, even if you are meeting the requirements. But you know who has benefited from these? Deloitte. They've made hundreds of millions of dollars because they got the contract to build this system. So that's kind of like the beneficiary of these sorts of things. No shade to Deloitte if anyone works there. And then we know if the state says, hey, we can't do this, we can't pay $80 million for SNAP, we can't, we need to eliminate some of these Medicaid services, it's very clear that we're going to see these costs pushed further downward, right? So we know that a lot of need is going to be coming in our charitable health providers, food pantries, food banks. And I think it's Facing Hunger Food Bank in the southern part of the state that said, we're not going to be able to meet this need if tens of millions of dollars of food assistance is lost. I think there's a data point that for every meal that food pantry provides, SNAP provides like 12 or 13. So food pantries, food banks obviously do so much in our communities, but they cannot replace systemic SNAP benefits. And they're going to have trouble and be under a lot of pressure trying to do that. The last thing I wanted to touch on is that it defunds SNAP education. I don't know if anyone's familiar with that. It's like WVU Extension's Family Nutrition Program. So I believe there's about 60 folks that work in that program that do Grow West Virginia and all kinds of education to help families cook healthy foods and combat obesity and a lot of different things. That program was completely defunded as part of this. So there's about 60 West Virginians who will be losing their jobs by October 1st. And then we're also going to lose that capacity to help families in all the ways that they do that right now. All right, and then just kind of taking this broader, I think a lot of the impetus for this bill, well, it was to extend tax cuts, but the stated impetus for this bill is, we've got to cut Medicaid, we've got to cut SNAP, because cutting that safety net from people will make them magically want to get a job. There's a there's a lot of flawed logic there because most people who are on Medicaid or SNAP already work, or they have a really good reason that they're not. But we know that this is actually going to have the opposite of the intended impact. This isn't going to help people find jobs. In fact, it's going to cost a lot of jobs. That $1 billion a year of loss of Medicaid dollars and federal healthcare dollars is going to create job losses in our healthcare sector. We think it'll be 2,000 to 3,000 jobs a year, just depending. That's just a rough estimate of what the impacts could be statewide, just in West Virginia. And we know that's going to have an impact, a downstream impact of the services that are available to people. And then, of course, people losing their job in a community, as Morgantown knows well, has downstream impacts of people shopping in places and home values and all kinds of different things. And then we also know SNAP cuts are going to have that kind of same rippling impact. If retailers and grocers are getting less reimbursements, less dollars, less people coming in the door, that's going to have an impact on jobs there. And then there are also cuts to things like clean energy tax credits that we know are expected to cost jobs in West Virginia and also raise energy prices. And what was it all for? We know the impetus was to extend the 2017 tax cuts and actually add new ones on top of that. An analysis by Penn Wharton, which is not left-leaning by any means, found that 80% of the tax benefits of this package go to the top 10% of households. When you factor in everything, the Medicaid cuts, the SNAP cuts, all of that, the bottom 40% of households, so nearly half of households, are expected to be in a worse off financial position because they get pretty meager tax cuts, but the loss of things like healthcare and SNAP are going to put them net negative as a result of this package. And households making $1 million or more, their average tax cut is $66,000. So just to put that in perspective, that's more than the average household in West Virginia makes in a year. And again, some of the arguments behind this are that it's going to grow the economy, it's going to lead to investment, it's going to raise the GDP. But that same Penn Wharton forecast found that it's actually estimated to reduce the GDP over the next decade. I think because of inflation and that inflation's impact on investments and costs. And it's also expected to depress wages. So wages for the average working household, in addition to not benefiting much from the tax cuts, folks could see their wages depressed over the next 10 years. Sorry. All right, so I'm going to get into pushing back, but I just wanted to flag a next thing on the horizon for folks. We also know that we're going to have to do this all over again with the discretionary budget for fiscal year 2026. In May, the Trump administration released their discretionary budget proposal. I think that president's budget proposals usually don't mean very much. Congress does it, but in this environment where this president has a lot of power over Congress to wield that power, it could be some foreshadowing of things to come. And I think this is something maybe we could send around to folks afterwards. I don't want to really go through it, but I'll hit some highlights that it would completely eliminate the low-income home energy assistance program that helped 45,000 West Virginia households in the most recent fiscal year we have available. Makes deep cuts to housing assistance programs. It eliminates community development block grants. Eliminates a lot of programs that are education related that help prepare adults and high school students for college. Unsurprisingly, cuts like CDC and NIH funding, and deeply cuts AmeriCorps and Job Corps beyond what we've already seen. So these, this is just a proposal. It's just a list of priorities on paper. It's nothing that's actually legislation yet, but just flagging for folks. These are kind of some of the next things. I think it also, I don't have it on here, but I believe it almost eliminates the Appalachian Regional Commission's funding. So there's a lot of things that are pretty important to West Virginia that we're going to have to get folks up to speed on pretty soon. And I think just to try to weave this together, taking all of these policies together, we talked about it a lot throughout this, but it's disproportionately harmful to West Virginia for all the reasons that we talked about, that we do have a lot of folks in federal jobs, a lot of folks reliant on these federal programs that are at risk. It's the largest cuts to food assistance and Medicaid in either program's history. And I think this is really important. It deeply undercuts our ability to respond to economic insecurity or anything, because not only are we cutting these programs like Medicaid and SNAP, we're also cutting the workforce that is like the safety net workforce, like AmeriCorps Vistas, SNAP Ed. So these are kind of like the folks that step in whenever those programs aren't enough, right? And we're getting rid of those too. So it feels like we're both getting rid of like these direct programs and also kind of this infrastructure that fills in the gaps that could make it just really difficult to be responsive to food and health needs. All right, let's talk about what we can do. So this is the implementation timeline I mentioned earlier. A lot of this stuff is phased in really slowly. The tax cuts go in right away, but a lot of the really painful provisions are phased in over a length of time. I mentioned already the ACA subsidies, those expire at the end of this year, so folks will start to feel the impacts of those as soon as January 1st. The work reporting requirements in SNAP, so suddenly people over the age of 55, people with kids over the age of 14, some veterans, some folks experiencing homelessness are going to be subject to these time limits and work requirements as a part of SNAP, or they won't be eligible anymore. The legislation said that went into effect upon passage, so technically it's in effect right now. But if you are someone or you know someone who's impacted by that, the feds have to like write rules about it, and then the states have to like implement them. So there is a little bit of a period of time before people start to be impacted by those. I say that to say, like, if you're looking for stories of impact, those are a couple of places to look right away. But those are also going to be pain points right away. So those are folks that are going to be losing their food assistance and need help and those sorts of things. There are some things I didn't touch on here related to Medicaid and SNAP cuts because they're not super impactful in West Virginia, but we heard a lot of narrative about Medicaid and SNAP being taken away from undocumented people. Those programs are already not available to those folks. A lot of the Medicaid and SNAP changes are, well, all of them are taking Medicaid and SNAP away from people with legal status, refugees, people who are here as a result of human trafficking, Afghan and Iraqis who are here who like helped the military. So those cuts don't impact a lot of people in West Virginia, but I think it's really important to push back against a lot of that disinformation that those folks, people who are undocumented, were already not eligible for these programs. The ones who are losing it are people who have lawful status. And yeah, just wanted to say that. So as far as what's next, our team is kind of starting to think about this in 3 buckets, and it feels hard because we're going to have to do a lot of things at once. So one, I think, is something y'all are working on very, very well, which is these provisions are deeply unpopular, but a lot of people don't know about them, and a lot of people don't know who is responsible. Once people understand what's in this package, they don't like it. I think it's like negative 26 favorability or something, but the problem is that most people don't know about it. So even as these things are taking time to phase in, we need to educate people about them. Whether you have like a political reason for doing that or whether we just want to make sure people are ready because they need to know what's coming and they need to be prepared for it. Alongside that, we need to be thinking about mutual aid because a lot of people in our state, a lot of our friends and neighbors are going to be losing their health care and their food assistance. I mentioned the SNAP and the ACA impacts are going to hit first due to the implementation timeline, but we're just going to have a lot more need in our state. We mentioned this demand on our charitable networks. Food pantries are going to see a lot more need. Charitable health providers like health rates and places are going to see a lot of need. So if that's a strength of yours to jump in and volunteer in those places, like please know that that's going to be needed. And then there's this other kind of mutual aid piece that like people are going to need help navigating all the new bureaucracy because we talked about how a lot of the people that lose their SNAP benefits or their Medicaid are technically eligible, but it's just like a difficult process. In Arkansas, a lot of people who lost coverage like didn't know that they had to do this stuff, or they moved and they didn't get the letter, or they threw the letter away, which I throw mail away all the time. So I think people are just going to need help navigating this process to stay eligible and to stay covered. So there's that mutual aid bucket. And then I think there's this third bucket that's mitigating harms via implementation, and state budget levers. So states are going to have to implement all of this, right? We said they're going to have to build these systems, and there are decisions that they're going to get to make. So one provision, the Medicaid eligibility, it says states have to check everyone's Medicaid eligibility at least every 6 months. Right now it's only every year, but they can do it more often than that if they want. And they can make that as hard or as easy as they want to. So there is like an advocacy lane for making sure that these systems are built to be as seamless as possible for people, to be as friendly as possible. And I think if you asked our members of Congress, they keep saying they want deserving people to keep their coverage. So we want to make it so that people who are eligible can keep their coverage. And that will be like an advocacy opportunity for folks as we're like building these systems and deciding what those policies and rules are. And then the third thing is, the second thing in the third bucket is like thinking about these state budget pressures. Is the state going to put up its share of SNAP, or is it going to say, we can't afford that? And there's questions right now, if you don't put up your full share, does that mean you have to pull up, like leave the SNAP program altogether, or can you just like put up a little bit and draw down less? With Medicaid, there's going to be immense pressure for lawmakers to say, okay, well, we'll just get rid of substance use treatment. Some of them are already angling to do that. So there's going to be a lot of pressure points in how this is implemented that give people an opportunity to weigh in and fight and try to make this as painless as possible. And then what's next is telling the story, right? These are quotes from the last 2 months. Our Representative Riley Moore said, so we've protected Medicaid for the citizens of West Virginia after his vote. And Senator Capito has said more times than I can count that the only people who will lose a benefit are the people who didn't deserve the benefit to begin with. I think I believe that people are deserving of healthcare and food. All people. I don't think there's a deservingness line. No one should go without either. But that said, in the next 2 years, we're going to see people who are like clearly sympathetic to the broader public who are going to lose health coverage and food assistance as a result of this legislation. We talked about it. We're going to have like grandparents raising grandkids who are suddenly subject to SNAP requirements to keep putting SNAP on the table. We're going to have parents who lose Medicaid, people experiencing homelessness, or veterans who lose access to these programs. So as much as folks have the capacity to connect with folks and make sure that we're telling the stories that deserving people are impacted by these policies, I think it's going to be really, really important. All right, I'm going to wrap up. This is just one last plug for the Doge tracker, and if there's something that we missed, or if somebody wants to follow up, have a conversation, please reach out. And then, yeah, you can sign up for our newsletter, and my contact information is there. Yeah, I'll stop there. Let's go this way.
Questions for Kelly?
I'm sorry, did you say that children above 14 will have to get jobs?
Sorry, their parents will be required to either work or lose their food assistance. And because SNAP is like one card your whole family gets, that child will have less, the whole household will have less food assistance.
The children will not have work requirements?
Not yet. Sorry if I misspoke on that one.
I have to ask, because you have such a great attitude, how do you maintain that? This bullshit going on.
I mean, do I have a great attitude? You caught me on the right day.
It seems like it.
I mean, I think like we all love this state. We love people who live here. We know that like we can do our little piece to try to mitigate harms as much as possible. And this isn't popular. I mean, I'm like heartened when I see that, the polling on this stuff isn't good. Like people agree that people should have health care and food assistance, and it's a long road, but I don't know. That wasn't a good answer.
I'm curious where you get your funding for West Virginia Center of Budget and Policy. Is it Any federal money or state money or?
Well, we have privilege in this moment that we do not receive any state or federal grants. We've never tried to, because that affords us an ability to say things that we want to. And that's one reason we did the Doge tracker, because we know a lot of folks that get state and federal funding obviously have lost those, and we want to be able to kind of like lift up things that others don't. We apply for grants, usually to do research projects, but also advocacy projects from regional and state and national private foundations. And you can check out our annual report on our website to see the specific funders.
You did great work.
Thank you. Barbara?
Thank you. First, I want to thank you, Kelly. When Kelly was a navigator in the days when maybe we didn't really know how important that was, she helped me get my cousin healthcare. And my cousin is still alive. We didn't know she was going to get she had workers' comp, and there was a gap before she was going to be forced, a 3-year gap, before she was going to be forced to get on Social Security, which meant her money was going to go down. So she's still alive. She is a frequent flyer at the hospital, but she's still here after all those years. So thank you very much for that. But just knowing what she's going through and what bad shape she's in, the thought of her having to upload documents. And I mean, to me, that's one of the. Do you think that's to be real? I mean, she can't afford to go to an ophthalmologist, so she can't see very well. She can barely see her phone. I mean, is that going to be common, do you think, for the reporting requirements?
It depends. I mean, I think we should all put in our input, because the state's going to have to, build the system. I think they can ask for it as little as every 6 months if they want to.
But is it going to be uploading? You think that's most likely? And then just knowing, that she lives outside the city, all the people who will be living outside towns and cities that can't get in because they're disabled, because of this, to take advantage, and that there'll be less staff than we used to be. I mean, it's going to be really, really hard for human services staff.
Yeah, I think, that's a big piece of it too. There's like human, not error, but a human factor involved. I remember when Medicaid expansion came in, that agency told us they didn't hire an additional caseworker. So 165,000 new people qualified for Medicaid, and it was the same amount of caseworkers trying to serve everybody. So they're overworked too, right? And there's like a human factor in them verifying those things.
Well, they should be fine then if they manage that.
Well, I know, in Arkansas, I don't think the program, I don't think they implemented it in a way that was kind to people, but the people could upload their pay stubs online, but the website went down every night from 7 to 7. And then people don't always have Wi-Fi, and you can't always get to the DHHR office, or maybe you can't wait in line. Maybe you finally got to the front of the line and it's time to pick up your kid from school. I mean, if they required this to get the mortgage interest deduction, or get my tax benefit of having employer-based insurance, we would all, I don't know. People with more means would be in the streets, but.
Thank you so much, and I agree about your attitude. It really helps the rest of us to hear the positive side. Thanks.
Kelly, is this the part where we mention all the people who come to the libraries to fill out the
Yes, you are going to be a lot busier.
But 90% of the libraries in the state, our internet is paid for through federal funds through the state.
Yes.
That we, as of right now, are told to assume that exists.
How many people come into the library to do this kind of stuff? Daily, right?
Yes, daily. We see at the main Morgantown Library, we see between 700 and 900 computer uses a month, plus Wi-Fi, which we don't track.
I think that's such an example of what we were saying earlier. It's we're making these programs harder to access, and then we're undercutting the helpers at the same time that's making it harder for people to successfully navigate it.
So our legislature made it easier to allow 14 and 15-year-olds to work, right?
Yes.
So about 14-year-olds going.
That's why I said not yet, yeah. Linda pointed out that there was a legislation that passed that weakened child labor protections in the state legislature this year. Goes into effect on Friday. I keep refreshing to see the Department of Labor's or Division of Labor's new rules, but yeah.
So parents don't have to give permission, schools don't have to sign off.
The school no longer has to sign off. I think parents still have to sign. It underwent some changes, but it deeply undermines.
But the kids also need to work overnight.
I hope not. I think the main thing is that the current system that will no longer be in effect on Friday ensures that parents know the legal requirements for children to work, and it kind of strips away that parental understanding and makes it so children could be exploited more easily because their parents won't know their protections as much anymore.
I remember seeing that the former head of Social Security explained
People on Social Security that were getting it when if they shouldn't were just like 0.3%, and that to implement anything that would track them would cost a lot more than they would cover. And it sounds like the bureaucracy and red tape is going to cost more to implement this program than they will ever recover. Is there a way we can find those numbers so that we can throw them back at the public to say what kind of ways fraud and abuse this program is?
Yeah, I think that's a great idea. I mean, I think, yeah, like the fraud rates in programs like SNAP and Medicaid are incredibly low. In Medicaid, they're usually on the provider side, not on the individual side. Senator Capito on the radio earlier this week said, like, people are, going to the doctor and billing 3 different states for their visit. It's like, how would you even do that? Like, so I think that is born of a lot of misinformation that is out there, and anything we can do to help people understand we're throwing the baby out with the bathwater.
Are those the kind of numbers you can collect?
I think we could help with that, yeah.
I don't know, maybe other people are facing the same thing, like I'm feeling like my mental image of nuts and bolts are just coming off, and then there's a little smoke and the cartoon.
Sorry, is that my fault?
No. I think it's, but I guess my question is twofold. One is this somehow ended up adding to the deficit.
Yes.
All these programs and this bill added, so that film thing and the wall and all those.
I didn't even mention that.
Yeah.
Thank you.
So I mean, just that it added to the deficit, and I wonder, in places like Arkansas or places that they tried to do this, was there a massive revolt, or did those people just internalize it? And how do you see that narrative playing out where this is happening? And do you have? And this might be a question that you don't even have the answer to. But.
Yeah. Remind me what your first question is. I lost it. I'm sorry. The nuts and bolts.
Yeah. The nuts and bolts was just a description of my being.
Yes.
But the question is in places where this is already happening, is there a massive rebellion? How is that actually played out in these states like Georgia, Arkansas, where they have that?
So in Arkansas, this was under the first Trump administration. The program was in place for 6 months, and a court ruled that it was not lawful because the first statutory purpose of Medicaid, you might be surprised to learn, is to provide people with health care, not to get them to get jobs. I don't know if that would stand now that Congress has done this requirement. That was just when the state chose to do that on their own. So it was put to a stop pretty quickly. New Hampshire is a state that started to try it and realized really quickly what unintended consequences it would have, throwing way more people off than they intended, so they kind of stopped. Georgia is a state that I mentioned that has work requirements in place right now, and basically no one has taken it up. There's a ProPublica story of a small business owner. He was the face of Georgia Medicaid expansion. I don't know if anyone saw that story. He's a mechanic, I don't know, he's a small business owner. Brian Kemp, the governor there, put him in ads about how great the Georgia Medicaid expansion is, and it's been in place for not even a year, and he's already gotten kicked off twice. Because it's and he's now the face of how this doesn't work. And he's the guy that's working, the small business, the person they put up front to say these are the people this is for. So I haven't seen a public revolt because I don't know that any of this has been was left in place long enough in any one place to for folks to really start to feel the impacts. But I think it's different story now that we're going to see 50 states have to roll this out. Not given a lot, it's a year of lead time, but that's not very much lead time to build a system. And maybe we can be the example.
And you mentioned a bunch, so one other question, you mentioned a bunch of different actions that we should take right now. But if
Not you all, someone.
No, but I think like us, like we're the
Yes.
ones that we've been waiting for.
Yes.
Like, so what are like the tangible actions people in this room can take and an organization, a broader resistance group like MICA can take? So like individual
What do
people.
we do?
What can we do to be like a change here?
This is as specific as I can get. I mean, I don't know. I think people need to like look at this list and ponder things that I haven't pondered yet on an individual level and think about where their strengths are. Maybe it's, volunteering at a food bank or a food pantry. Maybe it's annoying the people that made these decisions. Maybe it's, maybe you volunteered for VITA, like the tax assistants, and you're like, I can be really good at helping people navigate the SNAP paperwork. So I think on an individual level, it's just kind of like leaning into strengths and like we can help make a broader list of like kind of where the needs are. And on a bigger picture level, I don't think I'm allowed to say that.
I think we should just have people mail their paperwork to Riley Moore.
Oh. You have his cell phone number, am I right? Did he change it yet?
Yeah.
Any other questions?
I saw one back there, one here.
As the federal deficit grows, how will pay-as-you-go procedure in Congress impact things like Medicare?
I am over my skis on that, but I know that there are implications for that on Medicare, and I don't know enough about them, but I would find out if you would give me your contact information and I'll get back to you. I'm really sorry about that.
It's okay.
It's my understanding that Colorado produced state requirements for Medicaid, for work requirements, and lost very, very few people off the rolls. So I wonder if, we keep hearing about the nasty results. I wonder if there are at least one of the better result with Colorado.
Yeah, I mean, from what I've read from folks who have researched this a lot more than I have, the federal framework is specific enough to be like on the bad end, like the states that have done it really badly, because it doesn't allow, like in a good version of this, you would say, if you have counties that just have like systemic high unemployment, you wouldn't make them do this if there are like literally no jobs to apply for. Or if, there's, a coal mine closes down, maybe you could exempt those people. They didn't leave a lot of wiggle room for states to implement it in a way that worked for them. So I think there are ways that it could be better, but I think they kind of made a framework that's going to be challenging to work around.
So it's my understanding, like the state legislatures, they will actually be developing the policies and procedures, right? So which agency within the West Virginia state government will actually be writing out exactly what it is and how it will work?
The Department of Human Services, which used to be a piece of the DHHR, they oversee SNAP and Medicaid. I know there's a Medicaid, there's like a panel that is required to have Medicaid recipients on it to give input. I'm thinking out loud, I don't know if that's like an angle or like an opportunity for input. Medicaid, I forget what it's called, but there are some and then there's like rulemaking processes that people can have input in, but human services.
So you think that there would, sorry, I'm going to ask another question. So you think that there might be public hearings on this or no?
I asked some national partners that we work with, like sometimes when things like this happen, there have to be like public comment periods and things like that. And they were kind of like, no. But they committed to me to like put together a list of other possible opportunities for impact, and I'm happy to share that with you all. I think people are still like reading the bill and processing it and all those things. So that's something I'm happy to like bring back. What are the avenues for public input like on the administrative side of things? And to be quite honest, I think there's like a lot of good folks that run the SNAP program and run the Medicaid program that like want to help. They're there because they believe in those programs. So there are opportunities. I think, was there somebody in the back, or did we get that one?
I wanted to say, I think there's an opportunity to not just annoy the representatives who passed this, but to vote it out in 2026.
I think once we start educating masses on what has happened and how it's going to affect all these other people, then what we need to do is a massive drive to get people to vote differently in 2026 to fire these people. That's what we need.
Absolutely.
I'm not allowed to speak on that.
Thank you, Susan.
I mean, there's a reason that they're implementing a lot of this like after the midterm.
Right.
But I feel like Riley Moore thinks he's going to be around for a long time, so he's going to have to run again.
Back to the federal jobs in West Virginia. We've had some things happen here at the Supreme Court. So can you address where you think things are going now? More specifically, one example is, of course, it's been the big example of West Virginia, coal was not. So I read an article on Facebook the other day that not really much has been reinstated there. And so, that's supposed to be a big success. Oh, yeah, we got that back.
Yeah.
Can you address just in general, what do you think is going to happen there with federal jobs going forward now with the Supreme Court? Do you have any insight into that? And don't NIOSH think.
Well, what's happening?
I think there are probably other folks in this room that know more about that than I do. I mean, for the NIOSH stuff, I've been really relying on journalism and media stories. The way that we said that 400 job losses, we're actually relying on BLS data because we know there's like NIOSH, can we still count 200? We don't know. Some people were brought back, we don't know. So we're actually using jobs data to capture that, which means it's probably, there's a lag in it and it's probably inaccurate. And it also doesn't capture people who took the buyout or who retired early. So I don't know, but I think Paul knows.
They brought back 2 of the 3 divisions.
Okay.
But they weren't entirely full because people had already left, taken the buyout, or they just got another job because they were set up. But the 3rd division, which was pretty large, was wiped out entirely. Just took up the large new building. So I think maybe they brought back 150.
Okay.
Max.
Of a few hundred?
300 to 400. Can't say 3. So it's still bad, and also they were waiting for other parts of NIOSH up in Cincinnati, and that's because they wiped out pretty much several hundred people in Cincinnati off. That's what was another big office, and so all those people who were still waiting because they were still on administrative leave with the court order. I think now they're just going to wait.
Wow.
And the other thing is when somebody leaves now at NIOSH, nobody's replaced. There's no rehire. So the numbers keep going down. People get more and more set up, and they can get another job.
Yeah. And then the Bureau of the Fiscal Service, no one's been brought back there in Parkersburg,
Is it
right?
safe to say then that our representatives who say, oh, well, we got that coal program back, and then basically, yes, but is it functioning? Do you know?
Oh, well,
I mean, is there any function like there was before?
They have trouble spending money. The only reason, for the longest time, they couldn't spend more than like $25 or something. So they have a $1 million coal ban that goes out and does this surveillance, but they don't have the money to run it. So it's not functioning now. No, it might function eventually, but it's a court order. And it was said, I don't.
And morale's pretty good for the people left, right?
It feels like a funeral.
Yeah. We should drop off some chocolates or something. So that's the other way you get rid of people, right? Like make them feel really unwanted and
Get them in.
Is anybody tracking how things financially pan out between the losses and then the bringing back, and did it actually ever save any money at all, or did it end up costing more money in the long run? Just about.
yeah, I've seen some analyses. I mean, if you look at like federal spending, compared with this same month last year, it's higher. There has not been savings. And then there's, costs of like lawsuits and all of these things. So No. I read an article, or maybe it was even just a tweet, that was like, basically this is being done in both the most inefficient and painful way. The comparison was like, I could stop paying my water bill and it wouldn't actually save me very much money, but it would kind of like really bug the crap out of my family. Like it would be like deeply annoying and inconvenient and like life altering for my family. And it's kind of like, that's what this has been. Like you're really like messing with people, but you're not actually generating this savings.
You know, I hate to sound like an ambulance chaser, but I think that like with 14 and 15-year-olds working, they tend to get some of the worst jobs.
Yeah.
And are the most susceptible for health and safety issues. So I think if I don't hope for this, except for that, but the numbers would say they will, and those could be intensely sad stories.
Yeah.
You know, like loss of fingers and things, you know, or burns are like fallen in food service. And then they don't always have the attention span to learn what to do and what not. Anyway.
Or like the confidence to say, like, I probably shouldn't have to do this.
Right.
Yeah.
Right, Kelly, thank you for the talk.
Yeah.
I was wondering, is your center going to track how this is piling up on the hospitals?
Yeah, I mean, I think as much as we're able to, yeah. We can definitely, I mean, track like jobs in the healthcare sector. We're doing a separate project right now that's trying to look at like the OB landscape in the state and how that's changed over the last couple of decades. And in fact, there was someone from the state's ACOG chapter that testified about a bill that would have cut Medicaid in the state legislature. And then I spoke with her again about the federal stuff. I think other folks can speak to this better than I can, but like OB units or something that kind of like gets cut pretty early on when there's like financial trouble. So they were estimating like a handful of those could close. So yeah, really depressing stuff, but we will try to follow it. And then there's groups like West Virginians for Affordable Healthcare. They have somebody dedicated to story collection. So I know there are other orgs, CAG and others that are kind of stepping into this, and we need to figure out to coordinate how we're like distributing the work and sharing it and making sure it's all getting covered.
What about, we've been talking about hospitals and so forth, and I just overheard someone say,
before we started, saying that one of our representatives called someone and said, stop fear-mongering about closing hospitals in West Virginia. But that being said...
That did happen.
Yeah, I knew I heard it, but I just didn't know where it came from. So, but it sounded plausible. So hospitals are being impacted. There was a fear that Medicaid would impact
nursing home facilities.
And I'm not sure if that's changed, in the bill, or is there some real fears about hospitals and nursing homes? Are they still gonna be okay? And so the end part of that is this. Here's my voice. But if you're a hospital system, do they feel like, oh, we're okay, we don't have to say anything, or do they need to step up and say, hey, this is gonna hurt us? And also, the grocery association.
Yeah.
I mean, grocery stores. Yeah, certainly Kroger to some degree, or I don't know what's beyond Morgantown, but some of those stores are certainly, yeah, there's somewhere it's going to be, yeah.
That's working fine.
So on hospitals, like, yes, I think the Hospital Association said on average, like 22% of their revenue comes from Medicaid. So they're naturally going to be impacted by, that being cut by a third or whatever it is here in West Virginia. There was a report came out that said like 7 hospitals in West Virginia are on the margins where this could be enough to close them. At least one of those hospitals has come out, probably under pressure from congressional delegations saying like, hey, don't worry. But they also have a commitment to their staff to say like, everything's fine right now. So there's kind of some competing pressures there. So yes, there will be hospital impacts. A lot of it will be delayed. I think there are a lot of pressures on hospitals as employers and as people who ask for federal money to not sound alarms publicly, and that again is where like a lot of us can say things that they can't say. On nursing homes, I've seen some reporting that there is fear about nursing homes closing, but it's more of an indirect impact. And it's like hard to tell that story because then people say like, oh, you're just fear-mongering. But basically what we talked about, where there's going to be a lot of pressure on the state to come up with we're saying that the state has less ways to raise its share of Medicaid. It's going to put pressure on them to, like I said, get rid of those optional services, which they have to cover, I think, in institutional nursing home care, but not like home and community-based care, which could push more people into nursing homes. And then like reimbursement rates, if their reimbursement rates go down, which is a lever that the state can move up and down, could impact them. So we want to deal in facts and not hypothetical, so it's hard, but like yes, all of those things could absolutely be impacted. And you asked a third thing and I lost it. But it gives people wiggle room to say like, no, that's not going to happen.
The other thing was talking about food, like Dollar General mentioned back there, and so forth. I mean, SNAP dollars are used in these places. So
I think, yeah, like the people that benefit the most from SNAP are like Walmart and Dollar General. Yeah, totally. And I know as the legislation was being considered, those associations, whether it's healthcare associations, associations of retailers and grocers, they were active on this. But at some point, those folks are like, this is done and I have to ask my lawmakers for the next thing. So I think the willingness to speak out goes down. Although there are people like Josh Hawley, who's a senator from Missouri. I saw an interview with him from this week where he said, I hope none of this ever gets implemented. He said he got it pushed back to 2030, and he has that long. I don't know what doesn't start until 2030, and he hasn't that long to make sure that it's not implemented. I don't know. Oh, the other thing I wanted to say, I think in response to your thing that you didn't ask, there's like a rural hospital stabilization fund that they threw in to, I think, get Murkowski and some others to vote for it. So that's $10 billion a year for 5 years. If West Virginia got 2% of that, which we won't because we don't have 2% of the population, but 1/50th of it, we would get $200 million. And the hospitals say they're losing $1 billion. So.
On the discretionary budget, so this is someplace we can still take action. What is there? Has a magical deadline been thrown out for that one? What's the next? How it means July 4th or this one? Is there? Are we gonna go right up to the end of the fiscal year?
Yeah, I mean the fiscal year starts on October 1st, but like that's not how Congress has operated in recent years. Right. They do like continuing resolutions and things. So I don't know. I did see like today in my inbox a letter that's already circulating about like ARC funding. So I know there's like some urgency that people feel to like start educating, getting out in front of it, like that these priorities need to be included. But I guess it's technically October 1st, but it could probably slip past that.
Hearings have been set. I know the one for library funding is July 21st.
You know more than I do on this. So yes.
But has there been like a presidential push to do this before the end and not during continuing resolution?
I don't know.
Please join us for our next lecture in the series, Christian Nationalism, What Do We Do? Presented by Reverend Jenny Williams, faith organizer for the ACLU. Mountaineers Indivisible welcomes you to the free lecture at the Church of the Brethren on Thursday, August 14th from 6 to 7:30. Hope to see you there.